It's important to use validated screening questions to assess alcohol and drug use. Questions can be self-administered on a paper form or computer, or administered face-to-face by a member of the healthcare team. Patients may feel more comfortable and be more truthful when they self-administer the questions. Screening is often completed as part of the intake process in primary care clinics. How do patients feel about screening? The Cutting Back study assessed patient attitudes about screening for a variety of lifestyle issues, including tobacco use, obesity, and alcohol use. The majority of the respondents in this study felt that assessing alcohol use was an important part of healthcare. All adults should routinely be screened for alcohol use at least once a year. It may be most efficient to ask about alcohol at every patient visit in a primary care clinic. Even one screening question will identify most alcohol use above a moderate level. Here is an example of a single item screening question for alcohol. When was the last time you had 5 or more drinks in one day, or for a man, or 4 or more drinks in one day for a woman? A positive score would be if a patient reports having that many drinks or more in the past 3 months. Here is an example of a single question to screen for marijuana use. Any patient who reports use in the past year may benefit from a conversation with a health professional to address the potential harms of marijuana use. Here is an example of a single question to screen for drug use. In the past year, have you used or experimented with an illegal drug or used a prescription drug for non-medical reasons? A positive score would be a yes, and any patient who scores positive should receive further assessment. Patients who score positive on brief screening for alcohol or drug use may benefit from further screening to assess their level of risk. The audit is recommended for alcohol screening in adults, the DAST for screening for drugs in adults, and the CRAFT is an easy to administer 6-item screening questionnaire for alcohol and drug use in adolescents.